the use of testosterone has increased dramatically, threefold or more, over the last 10 years. There's been a lot of concern and conflicting evidence about the risks associated with testosterone therapy, particularly cardiovascular events like myocardial infarction and stroke over the last several years. In 2014, the FDA required manufacturers to add a warning about potential risks of venous thromboembolism to the label of all testosterone products. To date, there have been no published comparative large-scale studies examining the association of testosterone therapy and the risk of venous thromboembolism. As a result of this conflicting evidence and the broad media attention it has received, there are many men with clearly defined hypogonadism who are afraid to take testosterone therapy, and there may be physicians who are reluctant to prescribe testosterone therapy. It's important to acknowledge, for a man who is truly hypogonadal, there are clear risks to not taking testosterone therapy. Osteoporosis, sexual dysfunction, decrease in lean muscle mass, increased adiposity, and possible metabolic syndrome and cardiovascular disease. Our study is the first large-scale comparative study of testosterone therapy and venous thromboembolism. In this case-control study of over 30,000 commercially insured middle-aged and older men, we found that testosterone therapy was not associated with an increased risk of venous thromboembolism. So what does this study mean to patients and physicians? Certainly, with the big increase in testosterone prescribing over the last 10 years, coinciding with increased direct-to-consumer marketing and the big increase of commercial specialty men's hormone clinics, there are likely to be many men without hypogonadism who are seeking and taking testosterone therapy. And for these men, given the still unknown long-term risks of testosterone therapy, the benefit-risk ratio is not favorable. So it offers a basis for patients and physicians to have an evidence-based discussion about the potential benefit-risk assessment for this particular outcome. The next step for testosterone research is certainly more large-scale observational studies using large administrative databases and electronic medical records. Certainly more and longer and larger randomized clinical trials, and also more in-depth qualitative studies in which we can assess testosterone use that is discordant with clinical guidelines.
UTMB Health, working together to work wonders.